by now you probably heard that Oregon is going to be the first state to transition to universal healthcare. Or maybe you haven't heard it by now. If I were you and I heard about this information in this context, I would think maybe this is made up. Where is the official messaging from the state of Oregon? Why has nobody reached out to my business to talk about this? Maybe you haven't heard a whisper of this information even though you work in healthcare in the state of Oregon. As you could guess, it's complicated, but there is a team of Oregonians that is focused solely on engaging with the community and on how to communicate the nuances, the realities, and the possibilities of this universal healthcare system. It can feel like, where's Waldo, trying to figure out who's doing what, who's in charge of which thing, and who do you talk to if you've got a question? The Community Engagement and Communications Committee of the Universal Health Plan Governance Board knows that they need to engage with some of the key partners in Oregon, including federally recognized tribes, businesses, providers, clinics, CCOs, community-based organizations, disability-led organizations, and insurance carriers. A factor in this pace of official communication from the Universal Health Plan Governance Board to the people of Oregon is that the next iteration of the plan has not been finalized. The Finance and Revenue Committee and also the Plan Design and Expenditure Committee are working in unison, also with the Operations Committee, to deliver their recommendations back to the Universal Health Plan Governance Board for them all to decide collectively on an official first draft of the plan. That plan is due to be delivered back to the people of Oregon in summer 2025. And once that plan exists, then the Community Engagement and Communications Committee can work on strategies to bring that official first draft of a plan out towards Oregonians. Totally crystal clear, right? You got it? By October 2025, this committee is due to develop a dissemination plan and some communications materials, meaning the first draft of this plan will be made public in summer 2025, and by October 2025, the communications committee needs to have physical materials or printed materials available that people of Oregon can view. Between January 2026 and March 2026, this committee, the other committees, and the members of the governance board need to give a minimum of 10 presentations around Oregon about some of the nuances of this plan and about the potential path going forward. If you are a small business, a large business, you work for a CCO, a coordinated care organization, you work for a provider, and you want some more information from the governance board and from this community engagement and communications committee, please reach out to them. Please attend one of their meetings or send an email to the governance board. The governance board has a legal obligation to reach out to businesses, care providers, consumers, and healthcare industry leaders throughout Oregon, and that committee is partnering with different contractors to make sure that that legal obligation is met. That being said, if you have a specific request, if you have a specific need for communications from these groups, let them know. The Community Engagement and Communications Committee meets on the fourth Wednesday of the month at 1 p.m. The next meeting is May 28th. See you there.